Yeah, hello everyone. So, starting with the session of 200 Anatomy MCQ Series 5. So, this is the 5th session. So, already covered up the 4 sessions. So, am I audible? Let me know so that we can start the session. So, let me just check and then we can start the session. Yeah. Yeah, so yes, we can start the session now. I was just checking it. So yes, I am audible and we can start the session. This is the 5th session. So all those students who have missed out the previous session, so what they can do, they can just go through that previous session. That all sessions are just of 30 to 40 minutes each session is there, and that contains all important MCQs. So this is the 5th part, and myself Dr. Monalisa. Okay. So, I have got 8 years of teaching experience for the UG, PG, NEET and FMG aspirants. I have done my MD Anatomy from Armed Force Medical College, Pune. And this is my unlock code and also my referral code, which can be utilized by you if you want to be the part of free sessions on the Unacademy platform. So, my dear aspirants, I would like to tell you that do join the Telegram group link of this Let's Crack NEET PG Telegram group, where the updates of all upcoming sessions on the YouTube and on the special platform of Unacademy, which is specially free, and also the plus courses information is shared, and you can also ask your relevant doubt from the relevant educators of that subject. So that would be very useful for you. So do join that, do join that session and the group, and this is my code which can be used by you if you want to be the part of free sessions or take the subscription. Now, I would like to suggest you how you are going to ask a doubt on the Unacademy platform. So, click on ask doubt on the screen, thereafter take a picture or choose from the gallery on the screen, crop the image to highlight the specific question and select the correct subject to which the question belongs. So, this is how you can approach for asking the doubts. Okay. Now, download the Unacademy app and from the Play Store, and thereafter find your goal as NEET PG. Okay, and then type my name, Dr. Monalisa, and whoever class you want to check, you can type the name of the educator, and then what you have to do, you have to use a code that is ANAT10, which is acting as a referral code or unlock code, and you can be the part of free sessions on the Unacademy platform. Okay, and if you want to have information about the plus courses, that session will also come. Now, my dear aspirants, as I told you, we are starting with 200 Anatomy MCQ series for a quick revision of important anatomy MCQs. So, we have already covered up 4 sessions on the study. Those who have missed out, please do watch. The session link is provided on Let's Crack NEET PG Telegram group, also on Unacademy Telegram group. So, 2 p.m., 3 p.m., 4 p.m. and 5 p.m. Now, today I have targeted 3 sessions. 5th session is 10 a.m., 6th session 11 a.m. and 12 p.m. is the session for the 7th session. So these 7 sessions are taken on the platform of Let's Crack NEET PG YouTube channel, but the last 3 sessions will be on the platform of Unacademy. So special class session on the platform of Unacademy. So you can, again, you have to download the Unacademy app, use the code ANAT10, and then you can be the part of sessions, and you can be the part of these sessions. So I would also like to share the information regarding that. So 17 and 18 is the date when the session will be taken, and full 200 anatomy MCQs will be covered up, and after that I will ask from the students what they want, and we will start another series so that you can target your exam and you can get your desired rank. So this is all taking place on the Unacademy platform. The referral code has been shared with you, ANAT10. Now, special class के features क्या हैं? Now, special class feature is very important, as it is specially made free for the learners. Okay, so this Unacademy platform, which is the India's largest online platform, is giving you the opportunity to be the part of special sessions, and please grab that opportunity, because you will have an interactive live session with the top educators of Unacademy platform. And what is that? With that, what happens? You can have a classroom like feeling, and it is same as like a classroom. Okay, polls are conducted among the learners who are participating in the session, so you can have a competitive role also. So it is in a positive way, so you can know where you lies and how much effort you have to put in. Raise your hand and ask the doubt during the live session with the educators. Never miss a class. What I suggest, never miss a class, because if you get a notification, if you, for example, if you want to attend my sessions, free sessions on the Unacademy platform, or any information about the Plus course, you can follow me, and when you follow, you will always get a notification of my upcoming sessions. Also, the links of all the sessions is provided on Let's Crack NEET PG Telegram group and also on the Unacademy NEET PG group. Lecture notes can be taken, so it can be downloaded. The PDF notes can be downloaded once the session is over. Anytime, anywhere, study at your own place, and it's highly beneficial. So do join the special class. And my dear aspirants, I have already shared that special session which I am taking up is on the 17th and 18th, so I have already shared. So also I want to tell you that subscribe, like and share the Let's Crack NEET PG YouTube channel. And what is my referral code? So my referral code, if you want to take the Plus subscription, or if you want to be the part of free session and you are the first time user of Unacademy platform, you have to download the Unacademy app, find your goal as NEET PG, and thereafter use this code so that you can be the part of my free sessions. Now my dear aspirants, let's start with today's session. So starting with the first MCQ of today's session, all the best those students who have joined. So first MCQ, so let's start with this. Okay, gluteus space indicates which of the following space, whether it is prevertebral space, whether it is paravertebral, whether it is retropharyngeal space, whether it is peritonsillar space. So according to you, which is the correct answer? Gluteus space indicates which of the following? A, B, C and D. Which of the following is the correct answer? Your time begins now. Whether it is prevertebral, paravertebral, retropharyngeal or peritonsillar space. Question number 1. Mark the correct answer. I will give you 30 seconds for marking the correct answer, and then I will come up with the explanation. All the best to everyone. Which is the correct answer? A, B, C or D? Gluteus space indicates which of the following space? Question number 1. So my dear aspirants, the correct answer is, so let me give you the correct answer. When we are talking about gluteus space, this is the space which is also given. This is the another name for retropharyngeal space. So actually C is the correct answer. Retropharyngeal space is the correct answer. Exactly, the location of gluteus space is lying between, retropharyngeal space is exactly located between. So anteriorly, if we talk on the anterior aspect, anteriorly it is bounded by buccopharyngeal fascia or layer, and posteriorly lies the alar fascia. So exactly it is located between these two fascias. I will show you a diagram for it so that it will be clear to you. So see this diagram. In this diagram, you can clearly appreciate the two spaces. One is the retropharyngeal space and the other is danger space. So the danger space has been shown you with red color, and we can see the yellow color demarcation is for the retropharyngeal space. And what you can appreciate that exactly the retropharyngeal space is lying anterior to that of danger space. So let me see here. Can you see this is the danger space which has been shown with red color? Okay. So exact location of danger space is lying between the alar portion of deep cervical fascia and the prevertebral portion of deep cervical fascia. So what is the location of danger space? The exact location of danger space is between alar portion of deep cervical fascia and prevertebral portion of deep cervical fascia. Now anterior to it lies the true retropharyngeal space. Anterior to it lies the true retropharyngeal space, which is exactly lying between the buccopharyngeal fascia and that of alar portion of deep cervical fascia. So see here, this is the difference, and it is very important that you should know the difference between these two layers, because at times the students get confused. So it is very important that you should know the difference of these two spaces, that is the danger space and that of retropharyngeal space. So yes, can we move on to the second MCQ? So let's move on to the second MCQ for today's session. Okay. In dislocation of jaw, displacement of articular disc beyond the articular tubercle of the temporomandibular joint results from excessive spasm of which of the following muscle? Excessive spasm of which of the following muscle? Okay, everyone? Okay. So, which of the following is correct? Whether it is lateral pterygoid, medial pterygoid, buccinator or temporalis. So according to you, which is the correct answer? dislocation of jaw, there is displacement of articular disc beyond the articular tubercle of TM joint. So this is due to excessive spasm of which of the following muscle? Your time begins now. Lateral pterygoid, medial pterygoid, buccinator or temporalis. The hint which is provided is displacement beyond articular disc and articular tubercle of the TM joint. This is the hint provided. So what is the correct answer? So here if we talk about the correct option is lateral pterygoid muscle. Lateral pterygoid muscle. Why lateral pterygoid muscle is the correct answer? Because if we see the origin insertion, we can clearly demarcate that lateral pterygoid muscle is inserting into the articular disc and the fibrous capsule of TM joint. Let me show you this diagram. So what has been mentioned in the MCQ, in this clinical scenario MCQ, it is mentioned that displacement of the TM joint articular disc is occurring, as you can see here. The articular tubercle of TM joint, the displacement of articular disc beyond the articular tubercle of TM joint occurs. So any structure which is attached onto the TM joint is the correct answer. So, or the articular disc. So here what you can see, the outline of, let me just show you. This is the outline which you are seeing. This is the outline of, okay, this is the outline of lateral pterygoid muscle. This is the superior and inferior head of lateral pterygoid muscle, and in this diagram you can see the lateral pterygoid muscle is originating from infratemporal surface and lateral pterygoid plate, and as you can see the insertion point, so it is inserting, let me mark it with the red color. So as you can see, it is inserting into TM joint articular disc and also on the fibrous capsule and pterygoid fovea. So this is the only muscle which is going towards the TM joint. So the correct answer for this MCQ will be lateral pterygoid muscle. Let's move on to the next MCQ, that is MCQ number 3. Question number 3. Parasympathetic secretomotor fiber to parotid gland traverses through following except. So you have to know the correct pathway. So you have to know the correct pathway for attempting this answer right. Okay. So all of you please mark the correct answer. All of you please mark the correct answer. So here you have to know parasympathetic secretomotor fiber to parotid gland traverses through following except. So which is the correct answer? It is not traversing through which of the following structure? Otic ganglion, tympanic plexus, greater petrosal nerve, auriculotemporal nerve. This is auriculotemporal nerve. Auriculotemporal nerve. So according to you, which is the correct answer? Parasympathetic secretomotor fibers to parotid gland traverses through following except. Question number 3, mark the correct answer. So which of the following structure is not involved in secretomotor pathway for parotid gland? It is auriculotemporal. D is auriculotemporal nerve. So which is the correct answer, dear? So in this pathway, which is the correct answer? Whether it is otic, tympanic, greater petrosal or auriculotemporal. Actually the correct answer here will be question number 3, that is greater petrosal nerve. So here greater petrosal nerve is not traversed. Greater petrosal nerve fibers are not traversing through the secretomotor pathway. So let me show you this pathway so that it can be clear to you. Okay, so yes. Let me directly enlarge this diagram. So here what you can see, the origin of the preganglionic fibers is occurring from inferior salivary nucleus. Can you see? This is the inferior salivary nucleus from where the preganglionic fibers are originating through glossopharyngeal nerve, forms tympanic plexus and then relays in the otic ganglion. So and then passes through lesser it's not the greater petrosal nerve, it passes through lesser petrosal nerve, relays in otic ganglion. From here via auriculotemporal nerve, it postganglionic fibers passes and reaches the parotid gland. So in this diagram we can see here the whole pathway of secretomotor fibers of parotid gland, and we can clearly see that greater petrosal nerve is not involved in this pathway. Greater petrosal nerve is not involved in this pathway. So correct answer will be C. Let's move on to the next, that is question number 4. Posterior boundary of carotid triangle is, what is the posterior boundary of carotid triangle? Posterior boundary of carotid triangle. Which of the following structure is forming the posterior boundary of carotid triangle? A, whether it is superior belly of omohyoid, posterior belly of digastric, sternohyoid or sternocleidomastoid muscle. According to you, which is the correct answer? posterior boundary of carotid triangle is bounded by superior belly of omohyoid, posterior belly of digastric, sternohyoid or sternocleidomastoid muscle. Question number 4, mark the correct answer. Okay. Yes, mark the correct answer. If you are not knowing also, you can give the answer because I will come up with the explanation. So, you can rule out, few options can be clearly ruled out. So, mark the correct answer. Which of the following is forming the posterior boundary of carotid triangle? Your time begins now. Now, the correct answer is sternocleidomastoid muscle. Sternocleidomastoid muscle. So, let me show you the carotid triangle boundaries. So, my dear aspirants, let me slightly enlarge this diagram. So, when I am enlarging this diagram, we can see here there are 4 triangular space. Okay. So, let me use actually this is one triangular space which you are seeing. Okay. This is one, this is the another one and this is the another one. Okay. So, here we have 4 triangular spaces are there. So, we have to target which one. Let me use yellow color for this. So, I am just highlighting this, or we can use pink color. So, can you see here I am highlighting this pink triangular area. Why I am using pink color? So that we can know that it is carotid triangle. So, we have to know this is the carotid triangle. So, if we talk about the boundaries, so what you can see on the posterior aspect, it is bounded by this muscle. Can you see here sternocleidomastoid muscle, SCM. This is sternocleidomastoid muscle which is forming the posterior boundary. Clearly we can see that it is forming the posterior boundary. And on the superior aspect, anterosuperior aspect, you can see 2 muscles are there. One is the stylohyoid and the other is posterior belly of digastric. Posterior belly of, the other muscle is posterior belly of digastric. So, these are the muscles, posterior belly of digastric, stylohyoid, and the other one muscle which you are seeing here, this is the superior belly of omohyoid. Superior belly of omohyoid. So, yes, superior belly of omohyoid. So, that means that this triangular space which you are seeing, the triangular space which you are seeing. So, let me use, yeah. So, stylohyoid, okay, see here. So, this is exactly superior belly of stylohyoid, okay, and this is exactly stylohyoid and posterior belly of digastric which I have highlighted in green color, and posteriorly is the sternocleidomastoid muscle, and this is the whole outline of carotid triangle. So, yes, the correct answer here will be, for this option, the correct answer here will be sternocleidomastoid muscle. Posterior boundary of carotid triangle is bounded by sternocleidomastoid muscle. Let us move on to the 5th number MCQ. So, yes, all of the following are the contents of occipital triangle except. All of the following are the contents of occipital triangle except. So, question options are great auricular nerve, suprascapular nerve, lesser occipital nerve or occipital artery. With, according to you, which is the correct answer? All of the following are the contents of occipital triangle except. Question number 5th, mark the correct answer. Whether it is great auricular nerve, whether it is suprascapular nerve, whether it is lesser occipital nerve, whether it is occipital artery. Question number 5th, mark the correct answer. So, yes, give the answer what you think is the right one. All of the following are the contents except. So, yes. Yeah. So, yes, the correct answer here will be, if we mark the correct answer, this is the suprascapular nerve. So, suprascapular nerve is a branch of upper trunk. So, suprascapular nerve is a branch of upper trunk of brachial plexus. From the upper trunk of brachial plexus, 2 nerves are given. One is SS, another is nerve 2 subclavius. Okay. So, actually suprascapular nerve is not the content for the occipital triangle, but it is the content for the subclavian triangle. Yes. Yes, Rangraj. So, I think you are marking the correct answer of the 4th one. Okay. So, I would like, yes, Rangraj, yeah. So, see here, Rangraj. So, I would like to show the diagram for you. So, can you see, appreciate, this is a occipital triangle. So, can you see the green color triangular space is the subclavian triangle or supraclavicular. So, what you can see, the structures lying, the content is marked with green color. So the content is suprascapular nerve, nerve to subclavius, subclavian artery, subclavian vein and trunk of brachial plexus. So my dear aspirants, you can clearly see here that the contents of subclavian triangle is upper trunks of brachial plexus, and upper trunk is giving two branches, that is suprascapular nerve, nerve to subclavius. Also there is subclavian vessels which is lying here, and trunks of brachial plexus. When we are talking about the content for the occipital triangle, I am using red color. It's the occipital artery, spinal accessory nerve, C3 and C4 nerve, lesser occipital nerve, greater auricular nerve, transverse cervical nerve and supraclavicular nerve. So all these structures which are the content for the occipital triangle and subclavian triangle is highlighted by red and green color. So here the correct answer for question number 5 is B, suprascapular nerve, which is not the content of occipital triangle, but it's the content of subclavian triangle. Let's move on to question number 6. Cricoid cartilage lies at the level of which vertebral level? Cricoid cartilage lies at the level of which vertebral level? Your time begins now. So try to attempt. So today students are not attempting much of the answer. What happened? Whether if you are confused, also give the answer whether it is A, B, C or D. So yes, or you can write exactly the level. Okay, that would be also right. Cricoid cartilage. What is the level, dear? Cricoid cartilage. What is the level of cricoid cartilage according to you? So I will give 30 seconds. Whether it is C3, T4, C6 and C2. Okay. Rangraj, Sri Rangraj. What is the correct answer? Question number 6. C6 is the correct answer. C6, sixth cervical vertebra is the correct answer. Let me show you a diagram for it. Yes, absolutely right, Rangraj, absolutely right. Yeah, let me show a diagram for you. So can you see here, I have used this diagram where you can see C3 is the level. Yes, yes, it's C is the correct. C3 is the level which is the level for the hyoid bone, and C6, sixth cervical vertebra is the level for the cricoid cartilage. Is the level for cricoid cartilage. Absolutely right, both of you, absolutely right. Let's move on to question number 7. So which of the following structure is not forming the floor of fourth ventricle? Which of the following structure is not forming the floor of fourth ventricle? Whether it is hypoglossal triangle or nucleus, vagal triangle, facial colliculus or medullary velum. Question number 7, mark the correct answer. According to you, which of the following structure is not a content in the floor of fourth ventricle? Your time begins now. Floor of fourth ventricle. Question number 7. Which of the following is not in the floor of fourth ventricle? So we have got 4 options. Mark the correct answer. Rangraj, Yash, according to you, which is the correct answer? Not a content of floor of fourth ventricle. So yes, let me give the answer. I am waiting for you to reply. Okay, no worries, I will give the answer. The correct answer is medullary velum. Actually, when we are talking about medullary velum, it is not the content of the floor, but it is the content of, it is forming the roof. There is superior and inferior medullary velum. There is superior and there is inferior medullary velums, which is forming the roof of fourth ventricle, not the floor. All other structures which is mentioned in the option, that is hypoglossal triangle and nucleus, vagal triangle, dorsonucleus of vagus and also the facial colliculus, all these structures, absolutely right Sri and Yash. Yeah, all these structures are lying in the floor. So let me show you a diagram for it. Can you see here? This is the floor of fourth ventricle or the rhomboidal fossa, and the important structure which is lying here. So here this is the median sulcus which is dividing it into 2 parts. Okay, important structures here is the medial eminences, which you can see. This is the medial eminences. This structure is sulcus limitans, and also the very important rounded elevation is by facial colliculus. Lower down we can see the hypoglossal triangle, and still lower we can see the vagal triangle. So all these structures, important contents which is lying in the floor has been shown in this diagram, which is showing the important structure in the floor of fourth ventricle. Let's move on to the next. Interpeduncular fossa contains all except, question number 8, interpeduncular fossa contains all except. Interpeduncular fossa contains all except, whether it is mammillary body, posterior perforated substance, oculomotor nerve or ophthalmic nerve. Your time begins now. Mark the correct answer. Interpeduncular fossa contains all except. Yes, Rangraj, you are right. Hypoglossal triangle above and vagal triangle below. Now coming to question number 8, mark the correct answer. You will get 30 seconds for it. Interpeduncular fossa contains all except mammillary body, posterior perforated substance, oculomotor nerve, ophthalmic nerve. Okay, so let me tell you the correct answer. Question number 8, the correct answer is 8th D, ophthalmic nerve. Yash is also telling D. Actually, yes, the correct answer is D. Ophthalmic nerve is not the content. Okay, ophthalmic nerve is not the content of interpeduncular fossa. I would like to show you a diagram for the contents. Absolutely right, both of you. So see here, interpeduncular fossa is the region which is bounded on either side anteriorly. Yes, Pratima, absolutely right. It is having optic tract and optic chiasma, and the structure which is lying inside is pituitary stalk, tuber cinereum is lying there, mammillary body and oculomotor nerve. Oculomotor nerve. So what you can see, posteriorly it is bounded by pons, on either side by the cerebral peduncles, and these are the important structure, but not the optic nerve which was given. So what was the option? Ophthalmic nerve is not the content. See here, one more diagram is here. The important contents are posterior perforated substance. Please note down that trochlear nerve is also not the content of interpeduncular region, and the other contents are infundibulum, oculomotor nerve. So it is having oculomotor nerve, mammillary bodies. Okay, it will have the content mammillary bodies. So once more I want to tell the content. The contents are tuber cinereum. The content is tuber cinereum, infundibular stall, posterior perforated substance, mammillary body, oculomotor nerve. Yes, let's move on to the next. Pineal gland forms the floor of third ventricle, anterior wall of third ventricle, posterior wall of third ventricle, roof of third ventricle. So according to you, which is the correct answer? Pineal gland forms floor, anterior wall, posterior wall or roof of third ventricle. Everyone, Pratima, Yash, Shri, what is the correct answer for question number 9th? Okay, so pineal gland. Yeah. Yes, interpeduncular cistern में circle of Willis होता है. Yes, Sri Rangraj, that is interpeduncular cistern. Then we can see the circular. Now here I want the answer of question number 9. Pineal gland forms floor of third ventricle, posterior wall, anterior wall or roof of third ventricle. Mark the correct answer and your time begins now. Yes, so Sri Rangaraj is telling it's C. What about others? Rangaraj is telling C. That is the pineal gland is forming posterior wall. Absolutely right dear. Yes, so I would like to show you a diagram for it. I am enlarging it. So clearly you can see this is the pineal gland. Actually this is the irregular diverticulum like structure which is having so many irregularities here. This is the third ventricle. Okay, this is the third ventricle, this is the third ventricle, and you can see here pineal gland, posterior commissure, all these structures are lying posteriorly, that is posterior. So in this diagram you can appreciate the relations. Pineal gland is lying on the posterior aspect of the third ventricle. On its Anterior aspect is anterior commissure and the fornix, and on the floor aspect it is having optic chiasma, infundibulum, mammillary body, posterior perforated substance and tegmentum of midbrain. So actually you can see this diagram and revise the whole boundaries and relations of third ventricle. So clearly we have seen in the diagram that pineal gland forms the posterior wall of third ventricle. It is lying on the posterior aspect of third ventricle. Let's move on to question number 10th. Which area is out of blood brain barrier? So which area is out of blood brain barrier? We have got 4 options. Mark the correct answer. Which area is out of blood brain barrier? Your time begins now. Whether it is cerebral cortex, thalamus, fourth ventricle area of prostremia. According to you, which is the correct answer? Which of the following structure is lying outside the blood brain barrier? Mark the correct answer. Cerebral cortex, thalamus, fourth ventricle area, prostremia. The correct answer is area prostremia. The correct answer is area prostremia. Actually, the structures which is lying outside the blood brain barrier, the structure which is not having blood brain barrier is area prostremia, which is present in the, yes, absolutely right, D, which is present in the floor of fourth ventricle. Other than that, other structures are median eminences, subfornical region, posterior pituitary gland, pineal gland and lamina terminalis. Lamina terminalis. Also organum vasculosum. Actually, these are the structures which is lying in the walls of third and fourth ventricle. So this is called as circumventricular structures. Okay, so these are the structure which is lying outside the blood brain barrier. Question number 11. Inferior thyroid artery arises from which of the following? Inferior thyroid artery arises from which of the following? Whether it is first part of subclavian artery, internal carotid artery, third part of subclavian artery, thyrocervical trunk of the first part of subclavian artery. Question number 11, mark the correct answer. Inferior thyroid artery arises from which of the following? First part of subclavian artery, internal carotid artery, third part of subclavian artery, thyrocervical trunk of the first part of subclavian artery. Got it? Question number 11, mark the correct answer. Question number 11, mark the correct answer. So your time begins now, all of you. Rangaraj is telling D. What about others? Okay. What is the other one? Others are not replying. Okay, what happened? So the correct answer is D. Thyrocervical trunk, first part of subclavian artery. It's a branch from the first part of subclavian artery, but to be more specific, exactly it's a branch of thyrocervical trunk. Let me show you a diagram for it. So let me enlarge it. Can everybody appreciate here that this is the first part, and from the first part we have got the branches. This is the first part of subclavian artery. It is giving internal thoracic artery. It is giving internal thoracic artery as the branch, and it is giving thyrocervical trunk, which is again giving inferior thyroid artery, and it is giving another branch, that is vertebral artery also. So vertebral artery, thyrocervical trunk and that of internal thoracic. Direct branches of first part is internal thoracic artery, vertebral artery and transverse cervical and thyrocervical trunk, but यहाँ पे thyrocervical trunk is again giving the branch inferior thyroid artery. Second part से costocervical trunk है, third part से dorsal scapular artery होता है. So got it? So we have got the correct answer. The correct answer will be thyrocervical trunk of the first part of subclavian artery is the correct answer. Now let's move on to question number 12. All are involved in auditory pathway except which of the following component is not a part of auditory pathway? Which of the following component is not involved in auditory pathway? Vestibular nerve, cochlear nerve, trapezoid body, inferior colliculus. Question number 12, mark the correct answer. So yes, question number 12, mark the correct answer. The correct answer here is vestibular nerve. Actually, vestibular nerve is not involved in auditory, but it is for balancing. It is involved in vestibular pathway. Cochlear, trapezoid and inferior colliculus are the parts of auditory pathway. Only A option is correct. See here, I have included this auditory pathway where you can see the components are starting from cochlea, ventral and dorsal cochlear nerve is there, olivary complex, lateral lemniscus, inferior colliculus, medial geniculate body and the auditory cortex area number 41, hazel gyrus. Area number 41, hazel gyrus. Absolutely right, Sri Rangraj, absolutely right. Now question number 13, which of the following is not true about the anatomy of cerebellum? Which of the following is not true about, yes Rangraj, absolutely right, that is for balancing, related to medial longitudinal fasciculus, vestibular pathway. Now question number 13, which of the following is true about anatomy of cerebellum? So two more sessions are there connecting with this. We are starting at 11 and 12. So all of you do attend that. So which of the following is true about anatomy of cerebellum? Globus cells are present in the roof, vermis is present in the midline, flocconodular lobe is concerned with smoothing and coordination of movement, dentate nucleus is present as a medial most nucleus. According to you, which is the correct answer? Question number 13. The correct answer for question number 13, the correct answer is vermis is lying in the midline. So globus is cells are present in roof? No, absolutely not. It's the medial most, that is fastigal. Can you see here? This is the fastigal nucleus and this is the dentate nucleus which is the lateral most. This is the dentate nucleus which is the lateral most, and fastigal nucleus is called as the roof nucleus. It is the roof nucleus. Okay. So now, so flocconodular lobe is concerned with coordination of movement? No, it is concerned with equilibrium. It is concerned with equilibrium. Coordination of movement is the function of neocerebellum. Dentate nucleus is medial most? No, it is the lateral most. So only the correct option is B. So the correct option is B. See here, I have included diagram showing the lobes and I have also included another diagram where you can clearly appreciate this is the vermal part and it is midline. Globus, no dear, fastigal. Sri Rangaraj, see here, this is the fastigal nucleus which is medial most and this is forming the roof. This is lying in close to the roof of fourth ventricle. This is the medial. Fastigal is the correct answer, not the globus. Globus cells are present. It is the fastigal, dear. Sri Rangaraj, it is fastigal. It is the fastigal nucleus. So we have got dentate as the lateral most. Then we have got emboliform. Then we have got the globus and fastigal is the medial most. Got it everyone? So let's move on to the next one. So I have included this diagram where the vermal and hemisphere part, lateral projection of cerebral hemisphere projection has given the name, and all of you do revise this. This is very important. Got it, Sri Rangraj? Very good. Roof of suboccipital triangle is formed by, roof of suboccipital triangle is formed by A. Semispinalis capitis, rectus capitis posterior, major, erector spinae, obliquus capitis inferior. According to you, which is the correct answer? Semispinalis capitis, rectus capitis posterior, major, erector spinae, obliquus capitis inferior. Question number 14, mark the correct answer. Which is the correct one? The correct answer for the roof of suboccipital triangle is semispinalis capitis. I would like to show this diagram for you. Can you appreciate? Here what you can see, the muscle which has been dissected or cutted out is semispinalis capitis, which is forming the roof of this triangular space. This triangular space is the suboccipital triangle. This triangular space is the suboccipital triangle, and here we can see it is bounded by rectus capitis posterior major supromedially, suprolaterally by obliquus capitis superior, and inferiorly, I for inferiorly, that is obliquus capitis inferior. So roof is formed by semispinalis capitis muscle. Question number 15. Which of the following muscle is part of triceps coxae? Which of the following muscle is a part of triceps coxae? Whether it is obturator externus, gemellus muscle, that is gemellus group of muscle, piriformis or gluteus medius. According to you, which is the correct answer? Question number 15. Which of the following muscle is a part of triceps coxae? Mark the correct answer. The correct answer for this is gemellus group of muscle. Actually, the superior inferior gemellus along with the obturator internus muscle is the part of triceps coxae, is the part for the triceps coxae. Okay, see here, I would like to highlight this. Here you can see this is the obturator internus muscle, 15D, okay. No, 15B is the correct answer, dear. Let me explain. See here, this is the obturator internus muscle. Can you see here? And if you will see clearly, the obturator internus muscle is flanked on either side by gemellus superior and gemellus inferior. So this together, gemellus superior, inferior and obturator internus muscle is called as triceps coxae. Is called as triceps coxae. This three muscle together is called as triceps coxae. So we have got B as the correct answer. So we have got B as the correct answer. Very good performance, Rangraj, very good everyone, good participation. So don't worry, again from after 15 minutes I will start the session, that is 15 to 20 minutes, that is from 11 AM. So download the Unacademy app, find your goal as the NEET PG and use the code ANAT10 to see the free sessions on the Unacademy platform. So as I told you, 200 Anatomy MCQs, today I have taken, this is the 5th part, 2 more sessions on the YouTube channel, one at 11, another at 12 PM today, one after the another. So we will be able to cover the 7 parts. For the last 3 sessions, you have to come on the platform of Unacademy, download the Unacademy app, use the code ANAT10 and be the part of free session. Last 3 sessions of 200 Anatomy MCQ series will be taken on 17th and 18th for the NEET PG 2021. Unacademy platform, okay. Use the code ANAT10 for the being the part of this session. What are the benefits of Plus subscription? So I would like to summarize the benefit of Plus subscription. For the benefits of Plus subscription, you can be the part of live courses, all the live sessions targeting NEET PG exam or the INICT or the next exam or the university exam or the FMG exam is taken by the top educators on the Unacademy platform. You can attend all this course in a very constructive way so that you can target your desired rank and desired examination, and simultaneously for one for one subject there are more than 4 to 5 educators, so you can follow any one of them, study on your device of choice, learn from the top educators in the medical fields, and every 4th session is a doubt clearing session. There is always what you can see, there is always a live test and quizzes on the platform which will be extremely useful. You can assess high yield anatomy MCQs along with all the 19 subject MCQs which will be extremely beneficial for you, and you can be the part of session. Yeah, thank you so much Rangraj. And 25,000 and more high yield anatomy MCQs along with the 19 subject MCQs are there with a proper explanation. Coming soon is 1 year of subscription or more. You are getting Plus subscription notes also. So Plus course के जितने भी 19 subject हैं उसके notes भी आपको provide करेंगे, printed notes. So that is the positive point about the Plus subscription. So if you want to go in a structured way without any pause in your study, you have to take the Plus subscription. Use my code ANAT10 for 10% discount. Iconic subscription has the benefits of Plus subscription. Along with this, it is having the benefits of Prep Ladder. So clinical and integrated essential lectures, video lectures from Dream Team, QBank 3, Rapid Revision and Treasure Dream Team with the Dream Team of the Prep Ladder, their notes, their important their important QBanks, which is prepared by the dream team of Prep Ladder. You will get the printed notes. All these are the additional benefits will be provided in Iconic subscription along with the Plus subscription. Again, you can use my code ANAT10 if you are going to prepare for NEET PG, INICT or your next exam. So you should go for Iconic subscription. Now the batch courses starting from 18th August is the Focus FMG batch, professional second year batch, okay, for both university and next examination. Target next 2023 integrated batch. So yes, join with next 2023 integrated batch. This will be subject wise coverage for the targeting 2023 examination. NEET PG ultra fast track revision batches. These are all the batches coming from 18th August 2021. NEET PG 1 month pack is there, ultra fast track revision batch, emergency room MCQs, NEET PG test and analysis batch, last 3 year previous year MCQs, COVID test and grand test series. So you can assess these all things just by taking 1 month of package. So 25,000 more MCQs, high clinical questions of all the subjects, 19 subjects based on latest exam pattern, and includes detailed description of this. So all these opportunities can be availed by you if you are going to take the Plus subscription of Unacademy. So Med Genius Scholarship Test, date is 14th August, time and the time is 8 p.m. and first rank will get 100% scholarship for 1 year subscription, 2 to 4th rank 75%, 5 to 9 50%, and 10 to 19 rank will get 25% of the scholarship of Plus subscription for 1 year. All these are the benefits, so avail these benefits. It's absolutely free and participate in 14th August Med Genius Scholarship Test. Grand test timetable I am sharing with you. Join it if you are preparing for NEET PG 2021. So this is the information about 4-year subscription. Go for it, either for Plus or Iconic. Highly beneficial for first, second year students. Along with university exam, their preparation of the next exam can be done. Take 12 months of subscription and get additional 2 months absolutely free. Use the referral code ANAT10 for 10% discount. 1 month subscription at a very discounted rate of 4,500, another 450 rupees discount by using the code ANAT10. So at the end, I would like to show you this this slide where the comparison of NEET PG Plus subscription and Iconic subscription has been compared. So do participate in this, highly beneficial, and use the code ANAT10 to get 10% discount. All the best, all the best. We will meet. So again, I am starting the session from